Hello everyone, my name is Sajni K. Saji, second year MBT student in Musculoskeletal and Sports Physiotherapy from BCF College of Physiotherapy. In today's session, I will be talking about taping and physiotherapy, what it is, how it works, and how we apply it effectively in clinical practice. This session is prepared using two primary resources, the Equilibria Knowledge Series webinar on how effective is Kinesiology taping in clinical practice conducted by IAP Kollam branch, presented by Dr. K. Ganeshan on 29th October 2025, and textbook Rehabilitation of Sports Injuries, Scientific Basis and Clinical Applications by Prentice and Voigt. First of all, what is taping? Taping is a therapeutic technique where adhesive or elastic tape is applied on skin to support soft tissues, improve alignment, control joint motion, reduce pain, and enhance function. Evidence from recent studies suggests that taping may influence cutaneous mechanoreceptors, improve proprioceptive input, and produce short-term changes in pain and movement quality. Next, classification. Taping can be broadly classified into rigid or non-elastic taping, elastic or kinesiology taping, McConnell taping, functional or sports taping. Rigid or non-elastic taping provides firm support and restricts excessive movement, which is useful in ligament injuries and joint stabilization. Elastic or kinesiology taping allows full range of motion, where it is used for facilitation, inhibition, lymphatic drainage, and pain relief. McConnell taping is a rigid taping method primarily for patellofemoral alignment and biomechanical correction. Functional or sports taping supports specific movement patterns during activity. Clinical evidence shows that elastic taping is most effective when combined with exercise therapy. Contraindications of taping. Taping should not be used in the following conditions, such as open wounds, infections, or active inflammation, allergic reactions or sensitive skin, fragile or atrophic skin, deep vein thrombosis, malignancy over the area, unstable fracture, and areas with impaired sensation. Next, on to indications. Taping is commonly indicated for muscle strain and weakness, ligament sprains, joint instability, postural correction, edema and lymphatic compression, proprioceptive training, pain modulations. Research shows taping provides short-term improvements in pain and functional tasks. Then, principles. The fundamental principles of taping include, first of all, clean and prepare the area. Then position the joint or the muscle in optimal alignment. Apply anchors without tension. Then apply the corrective strips with a specific tension based on purpose. Avoid wrinkles to prevent skin irritation and check circulation and comfort after application. Then the basic principles include skin lifting, where the tape lifts the skins, which reduces pressure on the nociceptors and improve the lymphatic and venous flow, and pain modulation by activating mechanoreceptors, thus inhibiting the pain gate. Then it improves circulation, and it also have a psychological effect by this visible impact, which improve the patient confidence. Next, methods of application. Taping is applied using several standard methods. First one is I strip, straight strip used for muscle facilitation, inhibition, and pain relief. Y strip used to surround muscle bellies for dynamic correction techniques. Fan or web technique for swelling and lymphatic congestion conditions. Mechanical correction techniques, where rigid tapes used to reposition joints, such as in case of angle stabilization. Then space correction or decompression technique, where elastic tape with moderate stretch, which in effect lift the area, thus reducing the pressure and improving the blood flow. The last part is how we calculate the percentage of stretch of the tape. To calculate the percentage of stretch, there is an equation where the percentage of stretch is equal to stretch length minus the original length, which is divided by original length into 100. For example, if a 10 centimeter tape is should to stretch to be 13 centimeter, then the stretch percentage will be 30 percentage. So in kinesiology taping, typical stretch values are 0 to 10% for lymphatic technique, 10 to 35 for muscle facilitation and inhibition, 40 to 75 for ligament and mechanical correction, and 75 to 100 which is rarely used due to high tension. So this content was prepared from standard textbooks and advanced clinical teaching webinars to ensure accuracy and practical value. Thank you for watching this session.